We are live? Yes? Can you tell? Okay. Good evening, everyone, and welcome to the board meeting. We will start as usual with the Pledge of Allegiance. Please stand, all rise for the pledge. On three. 1, 2, 3. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Now, Mrs. Callahan is not with us right now, I don't believe. She didn't, no, she's not here. So if Miss Fennick can do the roll call?
Will do. Thank you. Ms. Johnson?
Yes.
Ms. Weisberg?
I'm here.
Okay. Ms. Bays?
Present.
Mr. Greenstein?
Here.
Okay. Ms. Gilliar?
Here.
Ms. Brooks?
Here.
Ms. Epstein?
Here.
Thank you.
Hey, thank you, Ms. Fennick. Okay, now we're going to, well, first, let me just ask, can you see how many people are watching? Somebody, I'm not able to see the live stream from here.
Looks like 143.
Okay, great. Okay, well, thank you to the 143 people, and hopefully there'll be some more shortly. Thanks for joining our live streamed board meeting tonight. As we did at the last meeting, we'll be taking emails from the community with your comments and questions and reading them into the record at the end of the meeting. Please send those questions and comments to BOE@portnet.org. Okay, and they will be read in. We're going to save some time at the end so that your questions can be heard. And the staff member who's best suited to answer your question will get back to you via email. For more global questions, like when will we hear an update about the virtual plan? For questions like that, there will be an answer in a Connect Ed shortly. The administrators are working pretty much 24/7, and I want everyone to know that. And with teacher support, they're going to be announcing the plan soon. I know there's a wide range of emotions out there, and due to the emails and the phone calls, we're very much aware of the concerns, as well as of the areas that have started to come together well. As I hope everyone does know, we did have our first cases of COVID in the district. We had 2 cases last week, and someone tested positive this week, of students, that is. Many parents have questions about the district's protocols. Tonight's discussion item will be a presentation by Dr. Stephanie Allen, who's here, and she's the district's director of pupil services. She'll be going over the protocols and how we respond to what is unfortunately going to inevitably be something that we have to contend with this fall. As the nation mourns Ruth Bader Ginsburg, an outstanding jurist who served this country for decades and who remains a hero, icon, and role model to a lot of us and to our daughters and sons, I thought I'd share one of her many memorable quotes. It seems especially appropriate during the ongoing crisis. RBG said, "So often in life, things that you regard as an impediment turn out to be a great good fortune." Okay, well, here we are, the 3rd week of school in a pandemic. What good is happening? Well, okay, We hosted 2 of our first ever Spanish speakers forums for our Latinx parents. The turnout was excellent. I want to thank the administrators who participated and hosted, and a special thanks to Shirley Sapiro and Dr. Kim Licata for their excellent translations. And I also want to thank fellow trustee Julie Epstein for her question reading in Spanish. That was excellent, Julie. Thank you. This is something we're going to continue to do. We're not going to let the virus derail our goals of greater inclusion, along with diversity and anti-racism teaching that we talked so much not that long ago. We'll update you on that at future meetings. We've heard many stories about teachers and administrators going above and beyond to make students feel welcome and comfortable. Your acts of kindness and commitment are appreciated, and I thank everybody for their patience and for the good things that are happening. Another positive is this, and as difficult as going virtual has been, more parents are participating in our board meetings and our committee meetings than ever before. We have discussed the possibility of the board meeting in person, notwithstanding the governor's executive order permitting virtual meetings. The meeting would still have to be live streamed and virtual because only a small percentage of the community would be able to attend in person. So we're talking about that as a board, but whatever way we go, we hope that parents stay involved as we work through the reopening issues, and that is going to happen. And we're going to move forward into the school year and deal with the new normal. And now I'm very proud to make the following announcement. This is some good news also. Schreiber High School was informed by the National Merit Scholarship Corporation. 16 students in the class of 2021, and that's a lot, have qualified for a semifinalist classification in the National Merit Scholarship Program. Over 1.5 million students nationwide took the qualifying test, and approximately 16,000 students have earned the designation of semifinalist. The students now will complete. They are competing, but they will complete an application form that includes information about academic performance, as well as a recommendation from the school counselor. This supporting documentation will be crucial in determining whether students become finalists in the process. The entire school community is very proud of the students' achievements and wishes them well. Now, and unfortunately, when we do this in person, the students are there, the families are there, people get up, we have a photo op. It's quite a nice occasion, but I hope everybody who's on this list, and I'm about to read it, is enjoying some time with their family, and I hope the parents are watching. So here are the semifinalists. Shane Berzin, Isaac Goldstein, Ryan Kessler, Mia Kurta, Jimin Lee, Noah Lowy, Rajan Park, I don't know how to pronounce it, I apologize, but Parekh, it's Parekh, Samantha Rudinsky, Daniel Ruskin, Alexandra Saltzman, Jacob Shore, Nathaniel Senders, I think it's Gavin Schaub, it's Schaub Gavin, but I believe it's Gavin Schaub, Jeffrey Sung, Eric Tang, and Avery von Rauschlaub. So to those students and their families, well done. So congratulations. And now, before going on to the rest of the meeting, I just want to remind everybody who's watching, and I think you've heard this before, but I feel compelled to say it. Please tell your children to wear their masks outside of school. We can tell them in school and we can monitor them in school, but it's so important for everybody's safety and health that this rule and social distancing be followed not only at school, of course, but outside of school, so we can keep the schools open as long as possible and keep everybody as healthy as possible. Thanks, be safe, and now I'm done, and we can move on. I am going to move to adopt the today's agenda, September 22nd. Do I have a second?
Happy to
I'll
second.
second.
Okay, Deb got there first. And if Elaine could do the roll call, thanks. Elaine, you have to unmute. Oh, it's not working?
I apologize. I feel like I played catch with that thing, trying to get it with the mouse. Miss Johnson,
I'm here.
Mrs. Weisberg,
Yes.
Mrs. Bays,
Yes.
Mr. Greenstein,
Yes.
Mrs. Gilliard,
Yes.
Mrs. Brooks,
Yes.
Mrs. Epstein.
Yes.
Thank you.
Okay, next we're on to the report of the superintendent. I don't know if Dr. Hines or Dr. Shields wants to go first.
Yeah, I'll ask Dr. Shields if you don't mind going first, and then I'll follow you.
Of course, thank you. We did an enrollment report on September 16th, and the total enrollment for the district is 5,269 students. That's 181 students less than we had this time last year. So that number was 5,269 students, K through 12. Thank you.
Thank you, Dr. Shields.
All right, thank you, Dr. Shields. So I have a few things I just want to update the community about. First and foremost, I want to thank our HSAs. I want to thank the presidents, and I want to thank Adrian Kane. Had a wonderful meeting with them this morning, and I look forward to continue to meet with them. Their support is really very helpful as we move and we navigate through these uncharted territories. To a Weber family, or families plural, I just want to clarify something. Tomorrow is a virtual Weber Wednesday. No students are coming to school tomorrow. I know I sent the letter out earlier today. I just want to make that clarification in case anybody may be confused with that. And speaking of what's happened over the past 2 weeks with our COVID-19 positive, cases that we've had here. I want to thank, one of our guests is here tonight, Dr. Allen, and I want to thank Dawn Bollerman, who is our COVID, I want to say officer at this point, because really amazing work. And, a lot, I know Dr. Allen will talk about this, but the behind the scenes things, situations that take place, the community doesn't really know, and I know Dr. Allen will articulate some of them. But the communications that go out to our community, please know that we are very aware of how important it is to have factual and real information out in as quick of a time frame as possible, and we will continue to improve in that area. And I just want you to know that it's extremely important for us to do that. The other thing I want to talk about, we talked about mask wearing, and one of the upsides of my office, looking out into the track over here, I also have the opportunity to view our amazing students outside, and it's always, believe me, it's always a treasure to see kids back in school. I have noticed at times when kids aren't, well, I shouldn't say kids, or young adults are not wearing masks, and so we take that very seriously here within all of our schools. And so, at times, our security guards will tell our students to remind them to make sure those masks are on if they're not socially distant. Now, if they're outside and they're socially distanced, that is totally fine. But I just want you to know that we are making a concerted effort to monitor that. We also have signage around the courtyard area, and we'll have signage as well on the fence by the track. So I just want to let the community know that. Now, the last thing I want to share with you, and I shared it with the board earlier, a decision has been made regarding Section 8, and the athletic schedule is due to come out. What I will do is post it. Well, I won't post it, but our amazing tech people will post it, as far as what the winter sports season looks like, what the fall sports season looks like, and of course the spring sports season. So that decision was made earlier today. We'll have that information for the community to see. to tomorrow. And I'm very excited that we will have something in place. I mean, of course, if something happens ahead of time, they'll have to make adjustments, but it's great to see that our students will have the opportunity to play come January. So more to come on that. There's a lot of things that we have to do internally to make sure everyone is safe, that we are compliant with all the different things that we have to take place. So we have meetings set up with our amazing athletic director and support, and we're working with our administrators, and we will be updating the community as soon as we have more information to share. So that's all I have right now. I look forward to Dr. Allen's presentation. I think it will be very helpful for the community. I know the board will have questions that they will ask, but I just can't say it enough. We're very thankful to have not only Dr. Allen's expertise, who talks to the Department of Health probably every day, as well as Dawn Bollerman, but you'll see what happens behind the scenes, and I think that will help the school community. Thank you.
Thank you, Dr. Hines. Okay, I'm going to make a motion for the approval of the board minutes dated August 17th, August 20th, August 25th, August 31st, and September 2nd. Do I have a second? Mr. Greenstein. Okay, Ms. Fennick, if you could do the roll call.
Sure. Mrs. Johnson,
Yes.
Mrs. Weisberg,
Yes.
Mrs. Bays,
Yes.
Mr. Greenstein,
Yes.
Mrs. Gilliar,
Yes.
Ms. Brooks,
Yes.
Mrs. Epstein.
Yes.
Thank you.
Okay, thank you. And now on to our discussion item. I'm happy to introduce Dr. Allen to those of you.
Nora, I'm sorry. Can I interrupt?
Did I miss
Are we
something?
going? No. Are we going to do the business portion of the meeting like we've been doing it in the past, and then leave the discussion item
I
for the?
don't think it's necessary tonight, really.
Okay.
I mean, I'm going to be here either way, so it's up to, we hadn't
So am
discussed
I.
that in advance. Dr. Allen, how long is your presentation? If you know.
It's not long. 1, 2, 3, 4, 5, 6, 7, 8 slides.
Okay, why don't we do the presentation, because we have gotten some feedback that people, want to see the presentations and then they don't want to hear the rest of the business, and I don't want anyone to be on the conference call any longer than they
Does that work for us?
want to be on. You're free to go, Larry. Okay, thank you, Dr. Allen. I'll turn it over to you.
Sure, no problem. Thank you for having me tonight. So yeah, as Dr. Hines mentioned, I'm going to kind of go over the process that we have in place here in Port. I think, John, you do have the presentation, so hopefully he'll get that up in a second. But so basically, I'll just take you through kind of how we got to where we are and where we continue to go to, because obviously it still needs some, refining as we learn more and more from the Department of Health. So, okay, next slide. All right, so just to start, how did we develop what our communication process is? So this summer, many of you know that we did have the district's reopening committee, and there was a separate subcommittee for health and safety that looked specifically at our building protocols, that looked at our COVID responsibilities, and looked at all of the guidance that's out there for us to review by the CDC, the New York State Department of Health, and then also later guidance that came out specifically from Nassau County Department of Health. So all of that was reviewed by the committee in detail. Our district medical coordinator, and also she's now our COVID coordinator, Dawn Bollerman, and another physician from the community were on that committee. So they gave lots of input, and they would research and questions that came up as we needed to. We also relied on our district attorney and our school physicians to give us any assistance in further interpreting some of the guidance. Sometimes there were conflicts. So we did need some assistance just in terms of what was the higher level or the higher standard that we would want to adhere to. We came up with the health screening, or I shouldn't say we came up with, but the health screening questions that are out there for our students and staffs and even visitors that come to the building came to us directly from the reopening New York State guidance that came to us over the summer. Employees fill that out now. We have a process we're working on for students, and even visitors have to fill something out before they come in. Anytime we have a concern, the main thing for us to do is contact the Department of Health, and they then start the contact tracing. Okay, next slide. So just to clarify some terms for us in terms when we talk about contact tracing and what we need to do for COVID-19. First, when we talk about isolation, that's someone that's actually tested positive for COVID-19. So they are on an isolation period. I know sometimes we use the quarantine and isolation interchangeably, but isolation, when we read that, is specific to the person that tested positive. Quarantine, however, now refers to those people that have been exposed to COVID or have had close contact with someone that tested positive. Close contact, and that's a big conversation. I know even when we've had the cases that have come up in the schools, what is close contact? We use the standard put out right now by New York State, which says it's closer than 6 feet for longer than 10 minutes. Also, that's with a mask or without a mask. It doesn't matter. Anytime you're closer than 6 feet for more than 10 minutes. And the contact tracing will begin 48 hours before the onset of symptoms and the person's isolation. So again, we refer back to that person that actually tested positive. We start 48 hours before that, who are our close contacts from that period. For someone who is asymptomatic that tests positive, we use the 48 hours, I shouldn't say we, the Department of Health guidance is that we use 48 hours from the date of that positive test. Proximate contact is another one that we talk a lot about and hear about, and the Department of Health does look at. This is anybody that's in that same enclosed environment as the person who did test positive, but they are now greater than 6 feet from the person. So they're not that closer than 6 feet for more than 10 minutes, but they might be, for example, in the same class as the student all day. That could be proximate contact. And again, Department of Health is going to tell us what we need to do in each one of these scenarios, but they will ask questions about this. Contact tracing, just for anyone that doesn't know, is that process used by the Department of Health to figure out who those close contacts are and who needs to be monitored through the next 10 to 14 days, depending upon the person. Mask breaks, just to clarify, so they have to be at least 6 feet apart, and this refers back to the close contact, and cannot be longer than 10 minutes. We want to make sure that everybody's safe, they're separated, and that nothing is that hits that 10-minute criteria. Okay, next slide. So what happens when we find that someone's positive? So first, we can hear either from the family or from the Department of Health. I'll talk, I think, in a later slide, but with some of the rapid testing, the Department of Health isn't actually being notified by the clinics, so we're hearing directly from the parents. So either way, if we hear from the parent, Dawn makes that call to the Department of Health to make sure they're aware, they're alerted, and we start getting some information. We're at this point really trying to filter everything through our building nurses, and they then will go to Dawn, our medical coordinator and COVID coordinator. The building nurses will try to get more information from the family and staff member initially. When were they in the building last? Were they on the bus? How did they get to school? Were they in school a full day? What pod are they in if we're talking about the middle school? If they're at the high school, what classes are they in? So we're really working on collecting all of this information in anticipation of our interview process with Department of Health. Dawn then will generally contact me if she hears it from one of the building nurses, and she'll also reach out to our school physician to loop her in. I then also make some contacts with central office as we learn information. We let facilities know, we let transportation know. We just want to make sure everybody in the school is alerted and aware so that each department can respond the way they need to. Our COVID coordinator, like I said before, calls the Department of Health with that information, and they begin the contact tracing process. That involves them contacting the family. So, next slide. Okay, so what's involved with that? We support their process. We get them the information they need. We share that initial information. They contact the family to get confirmation of the positive case. And as I mentioned before, sometimes they don't get information directly from the clinic because it was a rapid test. They will get notified if it's the nasal swab, and they will then generally be the one calling us. But a lot of families right now are going for the rapid test, so we're finding out first. And we'll let the Department of Health know. The Department of Health, first and foremost, even before they get information from us, does a detailed interview with the family. They want to know where they've been, where they tested positive, what the symptoms are they're experiencing. Are they the respiratory symptoms? Are they the gastro symptoms? Are they the muscle ache symptoms? What are they feeling? What are they experiencing? Where have they been? And then after that, they reach out to us for the school and to the school for that really more in-depth interview with us. Okay. What do they need from us? And I mentioned some of this before, but they need to know the school building. What's the grade of the student? If we're talking about a staff member, they want to know what building or buildings that person has been in. What was that date of last attendance? Because remember, we said with contact tracing, it begins that 48 hours prior to symptom onset or the date of positive testing, so that they want to know when was that student in the building last. If they were in school a week ago, it might not be as much of a concern as if they were in the school building yesterday. They want all of that information. They ask us a lot of information too about the safety protocols we have in place. Where are the desks? How are the desks situated? How much movement is going on? Are there other kids that come into the pods at other times? Do you have face shields up? Do they use face shields in other situations? The staff, are they wearing masks all the time? Do they have face shields? Are they using other PPE? So they really want all of that information. They also talk to us about proximate contacts. Who are those other students in the classroom? Who are the other staff members that might be in that particular room? A big question they asked us the last couple of times too was, how compliant are the students with the mask? And then how are those mask breaks being done? What rows are they in? How do you alternate your rows? Are we sure they're no longer than 10 minutes? How does the teacher time that out? They want a lot of information about that also. How did the student get to school? I mentioned that before. Did they take a bus? Did the parent drive them? Did they come with another family in the car? What's going on? And then in the past couple of instances, they have asked to speak to the administration as well, because they want that person to have direct contact with the staff members to really find some of this information out for us. Okay. And so what happens after that interview? Once they complete everything, they talk to us, they've talked to the family, they're going to advise us about the response that's required. And what does that mean? Do you need to close for 24 hours? Do you need to close for 2 weeks? Do you need to close a single classroom? Do you need to close a whole wing? They tell us what we need to do. They can tell us what we can do. We can't do less. So if they tell us we have to close for 24 hours, we have to close for 24 hours. We can, and out of the abundance of caution in the last couple of instances, we have decided to do more. In the previous cases, because of contact tracing and when symptoms were happening and the student was last in the building, there was not necessarily a response that we needed to do. But again, we wanted to be cautious. We wanted to do some extra cleaning. We wanted to give them an opportunity to do some more interviews, because DOH does follow the families on a regular basis throughout the time of isolation and quarantine. So it gives them a little bit more time also. Our school physician is also involved in this process. That she is made aware of what the DOH advises us, and then does either support that or give additional advice and guidance to us. So we use all of that information to make that final decision about any school closures. Important thing, the Department of Health does follow up directly with close contacts. They will sometimes tell the schools that we can follow up with the close contacts directly, or they will be doing that on their own. Anybody that's deemed either has tested positive or is a close contact is contacted regularly by the contact tracers for the next 10 to 14 days, depending upon what's going on. So that's why they're in direct communication with them. And they let them know what they need to do in terms of quarantine. Close contacts are monitored for 14 days just to see if any symptoms develop. The family that has tested positive also is monitored for that period of time, and they're to let us know when they can return to work. We'll talk about that in a second, because the timeline is a little bit different. And our COVID coordinator, Dawn's been great about reaching out periodically to check on people to see what's going on, to see how symptoms are developing, if they have any questions for us, any additional information for us, but just to stay in touch with the family as well. And as we've done in the other situations, obviously we send our communications out to the community to let them know about the situation and our potential school closures. Okay, so when can people return to school? Yeah, we've had a case, we've gone through the process. DOH says, yes, they're positive. These are the close contacts. What happens? Close contacts, as I mentioned before, are quarantined for 14 days from the date of last contact with the person who tested positive. So if the student was last in school on Monday and you were a close contact, you're out of school for 2 weeks from that Monday. Okay? After the 14 days, they can return to school as long as no symptoms have developed, and the DOH will give them a clearance letter. So they have that letter, they let us know they have the letter, and they're able to come back to school. A person who tested positive has to remain home for at least 10 days. In those 10 days, we watch symptoms, how that's going, what's happening with them. Are they fever-free? Are symptoms going away? So they can come back after 10 days from the symptom onset, 24 hours, which is actually CDC guidance on this one. That's the higher standard. New York State is 72 hours, but CDC says 24 hours of being fever-free without fever-reducing medication. And then all of the other symptoms are improving. The reason we don't necessarily need a positive COVID test from a person who previously tested positive is it can take a long time for those tests to come back positive. You can be asymptomatic, you're not contagious anymore, but you may still have traces of the virus, and those tests will still come back positive. So that's why we don't necessarily need a negative test. But again, the Department of Health will give us a clearance letter saying they can come back. Okay. Now, what about people who just have symptoms, right? So they haven't tested positive, they're just not feeling well, they wake up in the morning, they come to school, whatever it is, they have one of those symptoms on the checklist. So we send them home, or we tell them, advise them not to come to school, and we do advise them to follow up with their healthcare provider about their symptoms. Right now, the current guidance tells us that in order to return to school, if you had a symptom, so let's say you had a runny nose, you have to, at minimum, have documentation from a healthcare provider, a negative COVID test, and symptom resolution. All three of those conditions have to be met before that person can come back if they were showing any of those symptoms. We follow up with the COVID coordinator and our building nurse on any specific information, because sometimes there's nuances to it. We know a student, for example, might have chronic allergies. We know parents or staff members or students that have migraines. So that's a little bit more of a conversation between the nurses, our COVID coordinator, and potentially their healthcare provider. So for those more specific situations, but it's important that all three of those other conditions are met. Okay, that wasn't too long.
Thank you. No, that wasn't too long at all.
Plus I talked fast, so.
Very informative and interesting. Thank you. Questions from the board, if any? Okay, Deborah has a question.
Okay, so thank you.
Sure.
I learn every day about this. So I have several questions, but the one that's most pressing to me is if the Department of Health, if a parent takes a child for a rapid test and the Department of Health is not notified of the results of that rapid test, and the parent, for whatever reason, doesn't notify the school, where are we?
That's a tricky one. We're relying on the community to be honest with us. Most of the time, at least in the situations that we've dealt with so far, the students are identifying some sort of symptom. The family is calling us. They're letting us know, they're being upfront with us. My hope is that they would answer the screening questions honestly the next morning, because one of the questions on there is, have you tested positive for COVID in the last 14 days? And then we obviously follow up in turn if we see a yes to that question, because it's a negative, but we follow up with them. Okay. Fortunately, we haven't had to deal with that just yet.
And knock wood, we don't.
Right.
It takes a village, right? So my next question is, close contact by definition is anybody less than 6 feet.
Yes.
So let's say in some of the elementary schools, and I don't know if I guess the desk Weber and Schreiber are really at 6 feet, but maybe they shift a little bit. I don't know. But let's just take the elementary school. So by definition, it's really the children in the immediate orbit, I guess, around the positive student. Are those students, or whoever they are, you know, in any situation, do I understand correctly that they're currently in quarantine?
So because of the 48 hours window with contact tracing, we have not had a situation as of yet where the students in the class have been deemed close contacts. There have been situations where family members have been deemed close contacts, so they are quarantined. But the students in the class so far, because of that 48 hours, we've been okay. But to answer your question, if it was less than 48 hours, yes, they would be quarantined, you know.
Okay. And then the proximate contact is anybody basically in the classroom. And that's a precautionary quarantine if the family chooses to do that. The Department of Health is not mandating that.
Correct. Correct. You know, the big question that we had in that situation with proximate recently was about the mask compliance. How are the kids with the mask? Are the masks staying on? And then how it related to the student with their particular symptoms. And their assessment at that point was, even for the proximate contacts, we were in good shape. That there was not anything necessary given when the symptoms were, where the students were, how masks were handled. Also, the desk shields in the elementary schools was a big thing. They were glad to hear that we had that. That's an additional measure. So they take all of that into consideration.
Thank you.
Thank you. Okay, Larry has a question.
Rachel is first.
Oh, sorry. I missed that.
It's okay. I don't mind letting Larry go first. Or I'm going. Okay. Either way. So I think, Dr. Allen, first of all, thank you. I wish we had invited you to come speak in front of the public sooner, because I think you've lent a lot of clarity to a very, very complicated process. I'm with Mrs. Brooks. I understand a little bit better what we're doing now, and you've answered some of the questions that have really been keeping me awake at night. So I really appreciate the presentation. So all of this seems to me, the part that makes it the most difficult is that every single tiny little detail matters. And has to be tracked and carefully analyzed. And of course, children are not furniture. So it would be one thing if we could put things in a classroom and we knew that because we put them 6 feet apart, they were 6 feet apart. And we could answer those questions. And so one question that's been outstanding for me, and I think the answer is implied in what you've said, but I just want to make sure I'm understanding you correctly. I've been sort of concerned with the idea of whether or not the Department of Health is asking us what our policies are and what our rules are, or also asking us what the reality in that specific classroom has been over the previous few days. Because it seems to me that those details of what the reality is can really impact things, because a teacher, if you're talking to a teacher, will be able to tell them, you know, this child pulled their mask off, they weren't compliant, or maybe they all got a little too close together, they ran around, or we know some of the classrooms that were originally split when the desk shields came in, the class was put together sooner than the overall district thought classrooms were going to be put together. So suddenly all of those children, if we had had a case in one of those classrooms, those children are closer than 6 feet. But our official policy would have been that they would have been 6 feet. So I guess all of that is to ask you to confirm what I think is in your answer, which is we are really looking at the actual details of what is happening over the previous 48 hours, not just we made the right policy and so we're done. It worked perfectly.
No, absolutely. Absolutely. When, you know, we had the other situations last week with the 2 buildings, both Dr. Pernick and Dr. Suzanne spoke with the staff, the teachers, to get a handle on who was in there, what they were doing, how the kids were doing. When, for example, when Dr. Suzanne and I were on with the Department of Health, they were asking, like, tell us exactly how many children were in that room on that day. You know, how many kids were remote? How many kids are on the bus? Like, they were really asking all of those detailed information, questions. Are the windows on the bus open? I had a question that I had to take to Mr. Restano about the ventilation systems and how that was handled in the classroom. So they really are asking lots of detailed questions. It's not just here's our policy, here's our protocols, and that's that. They want real-time information.
I have one tiny follow-up, if the board will indulge me, but
Go ahead.
we've gotten, you know, not to go into specifics in public, but we've gotten a letter from a parent in one of these circumstances who felt that even though the correct protocols were followed in the classroom, that potentially their child was a little too close and that maybe they should be quarantining to err on the side of caution. If a parent has that feeling, who's the appropriate person for them to be raising this issue with? Does it go up the normal chain of command to the building, or should they really be coming up the chain of command to the COVID coordinators who have the expertise on this?
I would say, and we had a meeting earlier today with the reopening committee, my opinion of it is everything really should filter through the building nurses. They also know the medical questions that the Department of Health wants to know, and they'll be able to alleviate some of the concerns that the parents may have. If it needs to go beyond that, they'll either contact Dawn directly and/or building administration and me. So that's kind of the loop that we have going for all of this, but it really should start with the nurses.
Great. Thank you. They're really earning their salaries this year, the school nurses.
They are. They're an amazing group. They really are.
Thank you. And I agree with that. Julie has a question.
Wait, this time you did skip over me.
Larry and Emily.
I look at the bottom of the screen, so if you're not at the bottom, I don't. Okay. Larry.
Thank you.
Emily and then Julie. Okay, I got it.
All right. Well, thank you for this report. It's nice to know that we are going beyond what we need to do. With a close contact being anybody who's been within 6 feet for more than 10 minutes, I think the area that a lot of people have concern about is lunch, because we've heard reports that nobody can find a way to be more than 6 feet away in some of the buildings during lunch. And you might not even know if somebody's tested positive, they might not even know who was within 6 feet of them because it's not necessarily in their pod. And that's sort of the way where you can get it. Somebody would be missed in contact tracing. So the question is, what can we do to alleviate that and to make it that people do have more spaces to actually eat and be 6 feet apart, or at least be in pods who at least they'll know who the people that they've infected are.
Yeah, so I mean, that's probably something I can talk a little bit more in detail with the building principals about. When we spoke to Department of Health in both situations, they did ask about lunch and how that was handled. Dr. Pernick was able to answer how lunch was handled in his building and where the students are. And then in Dr. Suzanne's case, they might have even been eating in the classroom. So the desks are 6 feet apart, or they moved the desks 6 feet apart, but she had the specific information about that. But we could talk to the building principals a little bit more about lunch and what's going on in those particular situations to make it covered.
I believe Emily is next.
I am, but I think Rachel actually addressed what I was going to ask. But I do want to thank you, Dr. Allen, for this presentation. And I wanted to thank Dawn Bollerman and all the nurses for all the work that they've been doing with this. And really, my point, I guess, was to say that from the way I've understood it, is that every situation is going to be treated on a case-by-case basis, and there will be no set answers to how a particular case is handled. It really will depend on the classroom, the pod that the child is in, the exposure, whether they're asymptomatic or symptomatic. So I think that's one of the things that probably causes all the anxiety amongst us as board members. I know amongst the administrators, the teachers, and even our parent population, is that there is no 2 + 2 = 4 answer. So I appreciate you clarifying that again, and that's all I really wanted to say. Thank you.
No problem.
Thank you, Emily. Julie.
So before I ask my question, I will also echo those sentiments, Dr. Allen, and to Dawn Bullerman, to all of our school nurses. Thank you all for everything you're doing and that you will continue to have to do, unfortunately, the rest of this year, right? It's not going to get easier, it's going to become more, unfortunately. You did a great job, as always, outlining all of this and being very succinct and clear. I'm hoping that your presentation in its succinctness will be posted somewhere for people to reference on our reopening website, hopefully. I just wanted some clarification from you. Can you just one more time repeat the 48-hour time frame and clarify it's 48 hours from when that you were using as a standard, whether it's from the test result, the contact, etc.?
Okay, so for a person that actually tests positive and has symptoms, so there's really 2 categories. Test positive with symptoms. The 48 hours is from symptom onset. So they might have been not feeling well on Sunday, but they didn't go to get tested until Monday. We use Sunday. I shouldn't say we. Department of Health uses Sunday. For the person that's asymptomatic, nothing, not feeling well, they go for a test. Maybe they're going before school, going away. They had to get a test. They came back positive. We use the test date for the 48 hours.
Perfect, thank you. And can I also just clarify your last bullet, I think on your slide, did you include on there at some point that there is a negative test that's needed to return? And can you clarify again, who needs the negative test to return back to school?
Sure. So those are people that are just experiencing symptoms. They've come to school, they runny nose, we send them to the doctor. They have to have a health evaluation, a negative test, and symptom resolution. It's all 3 of those things.
Thank you.
Okay, Deb.
So aside from parents filling out the questionnaire, honestly, is there a big ask you have of the community that would help you in your job, or is that putting you on the spot too much?
No, I think, just please call us if you're concerned. And I know we're getting lots of calls, and I prefer for us to answer lots of questions because I do think that helps to alleviate anxiety. Emily's point before is so well taken. There are so many arrows in this flow chart that it's impossible for us to give a clear FAQ, like if this, then that. It just doesn't work that way. And we would much prefer to answer the questions. And if we don't know the answers, we're going to get them. But just call us, let us know what your concerns are, and we'll try to help you the best we can.
Thank you. Okay, Beth.
Dr. Allen, we have gotten multiple emails about the question of just screening testing of our staff, of our students in general. And I know there are guidelines from NYSED. So I thought now would be a good opportunity for you to sort of point out that there's a reason why we're not requiring that or doing that.
Meaning
mass testing of all of our students.
Yeah, I mean, they're not advising that, from state ed. They're just not saying. They're saying it's better off for us to figure out who those symptomatic people are and really pinpoint where the concerns are rather than this kind of mass testing. It doesn't really help us in many instances. And, we've had several meetings throughout the summer with the reopening. The second you have that test and you get the result, it's automatically contaminated the next time you go to the supermarket. So yeah, I could test positive, negative today, but I go to the supermarket tomorrow and pick something up, and that negative means nothing anymore. So we don't get a lot of information. It's an at the moment information, if that makes sense.
Thanks, Dr. Allen. And I believe also Dr. Hines a couple of times has pointed out that there was actually guidance from NYSED to not do that.
That's right. So I was just going to add to that, Beth. Thank you. It actually says very clearly within the guidance that we received in July to not do that. So, and I've answered a few parents with that exact language within that document.
Yeah, thanks. I'm glad that was brought up, Beth. Thank you. And thank you, Dr. Allen, for your response. Next, we have Rachel.
I'm actually okay now, but thank you.
Oh, you're welcome. Okay, Larry.
A couple of things. The places that do mass testing do it every 72 hours. So, and the question is whether we'd even be legally allowed to bar somebody from school if they chose not to get the test. I don't think we necessarily even have the legal authority to force a test. But anyway, my question is a little bit odd and granular. Assuming there's a person who has had a positive test, had met all the requirements to come back to school, and the next week shows a symptom that could be a COVID symptom, they can't get a negative test. So in that case, that would just be an individual decision made by the COVID coordinator. So it's not a hard and fast rule. It's everything's sort of on a case-to-case basis following these general guidelines. Is that correct?
Yes, and in that particular instance too, I would probably say, one, we would call the Department of Health again, and two, we would probably refer them to their healthcare provider again. You know,
right? They can take it up the doctor's note, but maybe not the negative test because they might still have the some of the fragments of the virus in their body.
Correct.
Right. Okay. Thanks.
Yeah.
Okay, thanks, Larry. Julie, question?
Yes, so Dr. Allen. So in all of this, you've heard Beth talk about, Ms. Weisberg bring up NICID. We know that the CDC offers their guidelines, New York State Department of Health, Nassau County Department of Health. Can you shed some light that if there's a conflict between guidelines or regulations, which do we follow as far as a school district first and foremost when there is a conflict between them?
So again, not an easy answer because it would be case by case. We would probably contact the school attorney and the school physician to get their input. Because we report to Nassau County Department of Health and they're the ones that would be doing our contact tracing, that I think also would be our first phone call and they would provide us with some advice and guidance. So between those three people, that's where we would figure out what we need to do.
Thank you.
Okay, Rachel.
So we're going to be entering cold and flu season. I'm going to give you a hypothetical. We have a child in school who's sneezing a lot, has a runny nose, coughing, any of those, name the symptoms. What are we going to do this year if we observe those kind of symptoms in school? What rises to the level of something where we are going to ask the parent to pick up the child in this year versus previous years, and what will they have to do to be able to be readmitted to school?
All right. So in each of our buildings, we have an isolation room, which is overseen by the nurses. So if in that hypothetical situation, the nurse is going to be contacted, the nurse is going to assess the situation, and the nurse is going to more than likely place that student in the isolation room. We're going to contact the family to have them come pick their child up. They're going to have to go home, check in with their healthcare provider. And I would say just generically that it would be based on that, you know, negative COVID test, healthcare provider, and symptom resolution rule unless they do test positive for the virus in order to come back.
So the theoretical implications would be sort of the same as in any other year. If you're sick, fever free for 24 hours, but also if you have general symptoms, you're going to need a negative COVID test to show that you can come back to school. So that'll be a big difference.
Yes.
So this isn't really a question for you, but a question that we should be considering is that as the winter months approach, we may have a lot of children who we are pulling in and out of school for symptoms that turn out to not be COVID. And we really should be thinking about how we want things to be set up to academically support them to make sure we don't have problems with continuity this year, since we already have a shortened year last year.
Right.
Okay, Deb has a question, and then Dr. Hines.
I'm wondering if the district is doing any follow-up after the contact tracing, given whatever period of time, contagion period, where we have a case. And I understand that DOH is monitoring the families that are affected, but are we doing any monitoring to see if the things we have put into place are working? Measures, the protective measures that we have put into place? Are the desk shields preventing the spread of contagion the way we hope? And in other words, are we successfully shielding the children who may be in proximate contact or close contact, but we are actually stopping the contagion from spreading because of the measures? Am I making sense? Are we doing any follow-up with that? For example, at Schreiber or Daly and now Weber when the time comes?
Right. So I think the short answer to that is yes, because we know the classes that are affected, we know what's going on, and we're keeping an eye on what's going on in those particular classes. Obviously, if another student comes up with the virus, unfortunately, then we would have to question whether or not it's our procedures that are in place and that are not protecting the child. I don't think it's an automatic if nobody else tests that our procedures are in place, but I think, when we meet regularly, these are all the things that we're talking about to make sure that what we have in place is actually working for our students and not only the students, I should say too, but the staff. Those were other questions that, the DOH brought up before, just kind of a sidebar. How about your teachers? Are they teaching next to students? Are they closer for 10 minutes? Where are they in the room related to everybody else? So they really are asking lots of questions.
Okay. And I'll share just for general knowledge. My daughter's pediatrician is hopeful that because the kids are wearing masks now, that flu season will be a little bit more easy on us.
Yeah.
It's not just your daughter's pediatrician. I think the CDC came out.
Yeah,
with
no,
that
I think it's been pretty well publicized.
I
Except
couldn't
the
speak
kids
for
take off
anybody
their
else.
mask the
So
moment they leave school, so it won't actually help.
Dr. Hines, you've been waiting patiently.
That was my question. It was about, because of all the preventative measures with the hand washing and the wearing of masks, I am hoping, I can't say I'm anticipating, but I am hoping that flu season will be not like it has been over the past several years. And that is my hope. I'm hoping we will be healthier for some of the things that we have been doing. But you already took the steam out of my question. So thank you.
Okay, any other questions for Dr. Allen from the board or any administrators?
I actually have one last question, a point of clarification, if possible. You said it earlier, but I'm just going to ask that you say it again. So in the cases that we've had so far in Port Washington, the classroom teachers were notified by the building administrators that there was a positive case in their class, correct?
Yes, they were.
Thank you. Okay, that's all. Thank you.
Thank you. Okay, thanks very much. That was
You're welcome.
very informative. Dr. Hines, you have a question? You were just moving?
No, I was just giving Dr. Allen a thumbs up. I mean, this
Okay.
is, and listen, she also has another job as executive director of PPS. So I don't know how in 24 hours within a day, how you're doing all this, but we greatly appreciate it.
Very much. And I actually said director of PPS. I should have said executive director, but thank you. Thank you very much. That was very, very informative. And I'm glad it's going to be up on the website so that, people can really look at it and digest it. And realize, though, as several board members pointed out, that each case is going to be individually investigated and assessed. And these are the protocol and the guidelines, but there are built in there is a lot of additional information that needs to be vetted, and that apparently we're very much on it, and I appreciate that. Thank you. Committee reports, and we actually did have some committee meetings. Usually I just zip right through them, but we did have committee report. We have a committee report, one from Policy and Personnel. Ms. Brooks?
yes, thank you. So last Wednesday, September 16th, the committee met for the first time during this school year. Chairperson was nominated and approved. That is yours truly, and I thank the board for the vote of confidence. I hope to serve you admirably. Dr. Shields gave us a personnel update. As many people are painfully aware, there have been a lot of vacancies in the district because of people going on medical leave and other valid reasons. So the office is working very hard, and the building principals are working very hard to fill those positions and to get those classes up and running. So Dr. Shields talked about that for quite a bit. We reviewed the 2020-21 tenure review process timeline, and that is ready to go. We reviewed policy for investment and purchasing. Those are policies that are standing that need to be reviewed annually, and there were no changes to those. We reviewed policy 8635, which is about the data privacy, security, breach, and notification. That is actually on tonight's agenda for a second reading and approval. That must be approved before October 1st. That's actually a state law. So I'm happy to say that we will meet that deadline. We reviewed policy 2330 for executive sessions. That will be on for a first reading tonight. Policy 2370, public participation, which will be on for adoption tonight. Chain of command and online distance and remote learning were on the agenda, but they will be rescheduled to a future date. Our agenda was very ambitious and we didn't get to it. We confirmed the meeting schedule for this year so the public can know. Our meetings will be scheduled on the third Wednesday of each month and will begin at 9:30 a.m. and for now will be virtual, but check the district calendar for all that information. And finally, we reviewed the pandemic policy. There was a lot of discussion about that. It will be put on for another agenda so that we can come back to discuss it publicly and for public comments. And the meetings to this, once they're approved, will be posted at a later date.
Okay, thank you. We did have a budget and facilities meeting. Miss Chairperson Weisberg.
Thank you, President Johnson. We met last Thursday, September 17th. We reviewed initially all of our facilities changes and upgrades that we've done to the facility. I'm happy to report that all HEPA filters were installed, all desk shields have been installed, and not as of Thursday's meeting, but as of Friday, all portable sinks were installed in the building, or 25 of the portable sinks that we've ordered have been installed in buildings. We got that update via email from Mr. Restano. So our facilities are in very good shape as far as the upgrades and changes that were necessary for COVID. We also reviewed some staffing requests that came through our administrators from Dr. Hines, Dr. Shields, and Dr. Mioli. Some staffing needs that will help us to safely move forward with all of our programs and planning, and also to safely, happily bring our students back to elementary school full-time as of next week. So that was very exciting news. And the board reviewed all of those staffing requests, and I believe many of them will be on this particular agenda and the rest on a future agenda. And then we went through the difficult news of how much additional money we have spent over and above what has been budgeted for this year. And we, with all of the additional staffing requests, facilities changes, and other needs that we've had are in the $2 million range at this point. Ms. Callahan did explain to us that we did have an overage last year of about that. So we're still in a position where we are not tapping into fund balance that we were not planning on tapping into. So things are somewhat okay, but it is definitely concerning the amount of money that we've spent. And we also reviewed, I believe, the one-to-one technology at that meeting, and the fact that that is actually fully implemented and everybody has their devices at this point. So that was it for budget and facilities. We will continue to meet because these needs are going to continue at rapid pace. So we will be meeting again between now and the next board meeting.
Okay. Great, thank you, Beth. I know we have not had a curriculum committee meeting yet, but is there any update on when we will have one? Rachel?
We're aiming for probably the beginning of October. There is a method to our madness in the fact that we haven't had a curriculum committee meeting yet. Our administrative liaison for the curriculum committee is Dr. Mioli. He is very, very, very busy, as anybody can imagine. And we thought it was really much more important that he focus on the things on his plate that directly impact every student in this district and getting everything up and running safely for this fall before we pulled him off onto our sort of long-term planning curriculum type issues, because though those are important as well, they can wait for the first week in October or the second week of October instead of mid-September. So it should be posted soon. We're going to be conferring on the schedule, and we will then post the first date and let everybody know.
Okay, thank you. And thank you, Dr. Mioli, for being too busy to have a curriculum committee meeting. Thank you. Okay, I don't think there were any other committee meetings, so I'm going to move on now to the action items. I'm going to just just mention, sorry, action item 11.3, and we are accepting, once we approve this, a donation in the amount of $3,000 to the Jan Havasu Scholarship Fund. I don't know who the generous donor is, but on behalf of the board and the students and the community and the administrators, I say thank you. Okay, I'm going to make a motion for the approval of items 11.1 through 11.6. Do I have a second? Mr. Greenstein. Okay, Elaine, can you please do the honors?
Yes, I can. Mrs. Johnson,
Yes.
Mrs. Weisberg,
Yes.
Mrs. Bays,
Yes.
Mr. Greenstein,
Yes.
Mrs. Gilliar,
Yes.
Mrs. Brooks,
Yes.
Mrs. Epstein.
Yes.
Thank you.
Okay, if there are no questions, I'm going to go on to section 12, which is board policy. We have, let me see here. We have two policies on for tonight for adoption. I guess I should
Shush, 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 shush.
separately or do them together? I haven't had two at once. I guess we'll vote on them separately. Policy 2370, public participation at board meetings. I'm going to make a motion for the adoption of that. I'll do them together. Policy 2370, public participation at board meetings, and policy 8635, information and data privacy, security, breach, and notification. So those two policies are on, and they've been on for first and second readings. So now we're moving to adopt them. Do I have a second?
I'll second.
Okay, Ms. Brooks. Ms. Fennick, could you do the roll call again?
Will do. Mrs. Johnson,
Yes.
Mrs. Weisberg,
Yes.
Mrs. Bays,
Yes.
Mr. Greenstein,
Yes.
Mrs. Gilliar,
Yes.
Mrs. Brooks,
Yes.
Mrs. Epstein.
Yes.
Thank you.
Okay, thanks, everybody. Now we have to approve a policy that is on for the first reading, and that is policy 2330 regarding executive sessions. Do I have a second?
I can second that one also.
Thank you, Ms. Brooks. Ms. Fennick?
I'm ready.
Okay,
Mrs. Johnson,
yes.
Mrs. Weisberg,
Yes.
Mrs. Bays,
Yes.
Mr. Greenstein,
Yes.
Mrs. Gilliar,
Yes.
Mrs. Brooks,
Yes.
Mrs. Epstein.
Yes.
Thank you, everyone.
Okay, next on the agenda is a informational item with a list of teachers and teaching assistants that will be up for tenure. It's on the agenda, so which is public, so anybody can see that. I'm not going to go through all the names. I don't think it's necessary. But I'm going to move on. Does anybody have any old business that they would like to discuss? Anybody have any new business? Okay, now is the opportunity for us to, what time is it? 9:11. We're going to read the emails that we have received from the community. And as I said earlier, those emails that are, questions that require responses will be directed to the staff member best able to respond. And for those questions that are more global, there will be upcoming Connect Eds and announcements, but let's see what we have. So I think we decided that Beth or Emily are going to read the question into the
I
record.
got it.
Okay, thanks.
You're welcome.
How many do we have, by the way?
I haven't counted, but enough. I can get through them all.
Okay.
Provided we don't get another, 30 right now. But what we have now, we have one comment or question actually from Lauren Edelstein, and I have the exact same question from Barry Kreftes. So I'm going to read that all at once. It's, can you please address Wednesdays at Weber? Why can't the middle school run the same way as Schreiber and have students attend every other day instead of only twice a week? I have a question here from a Claire Cabot. Ms. Cabot, I'm not going to read your question because it's a lot of personal detail about your child. But what I will say is your question is, how do I get help or answers on how to help my child navigate through the remote learning system and that kind of information? You contacting your building's principal, or in your case, as a Weber student, probably your building assistant principal that's assigned to the child's house, is the best way to solve that answer. And I think that's a global answer for everybody, that I'd just like to say the best place to get information is from the administrator at your student's building, assistant principals at the secondary level, middle school and high school, and your building principals at your elementary school. So I think we've been trying to say that, but I'd like to reiterate that comment. I have a comment from Adina Schneider. Masks at lunch. Kids are walking around Weber classroom at lunch, forgetting they don't have masks on. I have a comment from Mr. Josh Lichtenstein. There are many parents with relevant technology, remote communication, broadcasting, education, health, and medical expertise who are eager to assist the district. What has been done to get the district to let those parents help them to solve the problems we face? The next comment is from Ms. Adina Schneider again. Nobody from the Department of Health is contacting parents of close contacts. From Ms. Dana Rochester, our children in elementary schools are closer than 6 feet and thus close contacts. The DOH did not interview anybody in the affected daily class. Other districts have mandatory quarantine policies at the elementary school because children are not reliable historians. Why have we not implemented a quarantine policy for the elementary schools? This is critical to prevent the spread of infection in our community. From Jean Marie Lavigne, when the public gets notice that there was a positive case, can there be a reminder that the classroom, pod, etc. will be notified? And if this is already done, can this be made in the notification, i.e. a student in the building tested positive, the class/pod has been notified? Again, from Ms. Rochester, the infected child in my daughter's class became symptomatic 48 hours after she was last in school. Why were we not quarantined? From Nanette Melkonian, are students in isolation or quarantine afforded the fully virtual learning plan during that time? Again, from Ms. Rochester, the guidelines state that an individual is symptomatic within 48 hours of symptom onset, not positive test results. This child was contagious. Why were we not quarantined? From Alexandra Fagan, please explain to the community why the district is not testing staff and students. I realize it's not mandated by the state, but wouldn't it help keep our schools safe?
I think it was actually addressed by Dr. Hines and Dr. Andrew.
Agreed. Some of these I think have actually been addressed, but we committed to reading them. So we
No,
will
of
see.
course, of course. I just wanted the
Agreed.
writer of that to know that that was already answered, but go ahead.
Again, from Jean Marie Lavigne, my children have seasonal allergies and severe allergies to dust. I've sent in a doctor's note from their allergist. If they sneeze, are you going to force them to get tested every time or forced to quarantine, especially if they are only showing signs to allergies? This would be disruptive to their education and costly. Jessica Melwani. First, does the district have any partnerships with local health providers or hospital systems to accommodate testing at this scale that may be required in the coming months? Many in our community do not have the resources to easily find, access, or pay for testing that may be required for reentry every time a student exhibits symptoms of illness. And that was it. We got through them all.
Okay, well, thank you. Thank you, Weisbird, and thank you to the community for staying with us and giving us your input and answering.
Nora,
And yes, sorry.
we're going to respond to the people who've written these emails. Are we also going to post those responses on the website because other people may be interested in somebody else's question?
We can include the responses maybe in the minutes. Do you want of the meeting?
Yeah, I mean the ones that don't deal with specific persons, but like
The ones that don't deal with
testing
specific persons.
could go up on the website and everybody could read it, even if they weren't the person who answered the question. Things about specific children, or of course, we're not going to respond publicly on.
Okay, we will.
I think including them in the minutes is a better solution, because they're just thinking about the website. There is really a dedicated spot for questions from this particular meeting, but if we put them as part of the minutes,
that's fine. Just as long as they're somewhere so that people can take a look at them who may not, have asked the question but is still interested in the answer, like us, for example. So.
Got it.
I think that makes sense. Okay, they'll be in the minutes. Does anybody else have anything before we? Yes, Rachel.
I just have a question. So to the extent, though, some of those questions were sort of pressing COVID-related questions. So I just want to note for the people who asked them that I don't, even though we're following the rules that we set out at the beginning, that we weren't going to be answering them during the meeting, we were simply going to read them into the record. I'm assuming that somebody will follow up with the ones that are more pressing.
Yeah. Rachel, as I read them, I forwarded them to the appropriate administrator who could answer the question.
Of course.
Fantastic. Thank you, Beth. Because
You're
some
welcome.
of those, we've had a fantastic COVID presentation tonight that I think allayed many fears. And I think some of those questions are going to raise some further concerns. So I think everybody should know that that the administration is on top of it.
And I think a lot of the questions were actually already answered in the presentation. So I think it's good if they're just answered again.
Sorry, Emily, are you saying some of them were answered?
I think some of the questions that we got were already answered as part of the presentation, but I think Dr. Allen will probably, address them again.
I have no doubt that
I think that's true. I meant more the ones where people are raising concerns about maybe saying that they didn't feel that the procedure was followed correctly, or raising concerns about the procedure that was followed. So thank you in advance, Dr. Allen. It seems your work here is not done. But I don't think you thought that it would be.
But as usual, Dr. Allen will respond promptly, as our other administrators do, and as we do try to do as a board. So thank you, everybody, and thanks to the people out there for sticking with us. Thank you to my colleagues. Thank you to my mother. No. Okay, thank you, everybody, and have a really safe, good evening. Thank you. Bye-bye.